So tell me this. Why is it that according to the US Department of Health and Human Services that black infants die at 4 times the rate than their white counterparts? What's going on in America? Let's find out. Welcome back to Real with O'Neil.
It's real.
So if you haven't heard, the pandemic is disproportionately affecting the black and brown community. It might be because of different comorbidities that keeps them susceptible to illnesses, whether it be high blood pressure, diabetes, lack of education, or lack of opportunity, lack of equipment, to yada yada yada. The list goes on. But every single time we come around to this discussion, this topic and it's proven by so many studies, it's because of racism. It's racism, it's systemic racism, it's subconscious racism within the healthcare industry. Now, I really want to talk to you guys about the reopening of businesses. Look at Georgia, for instance. What businesses are they opening? Barbershops, salons, different businesses that affect a specific group of people. Are they, what I hate about this is that people are so selfish that they are willing to sacrifice people, not, and of course it doesn't affect them, but it's directly affecting a specific group of people. In fact, the CDC proves this. Check this out. They surveyed 8 Georgian hospitals, y'all. Researchers found that in a sample of 305 COVID-19 patients, 247 of them were black. That's 80%. 80% of the patients that they were seeing were black in Georgia, but they want to open up the businesses. And they want to open up those specific businesses that's going to affect who? The black and brown community. Guys, I always preach in all my videos that social solidarity, us coming together and looking at this as a national problem, not a regional problem. This is not a New York issue. This is not a Texas issue, Florida, Georgia, white, black, rich, poor, gay, straight. It doesn't matter. It's a virus. It doesn't care. It doesn't care what you look like. It doesn't care what boundaries are going to stop it from getting to where. It doesn't matter. It will affect the most vulnerable and it will kill the most vulnerable. And guess what? Historically speaking, the most vulnerable community, time and time again, is the black and brown community. Now, don't get me wrong. Of course, there's different facets, different tenets of society, different tenets of the community that will make it more susceptible to pandemics and flus. But like I said, it always comes back around to racism within the industry. In fact, just another article, y'all, and this is incredible. I really want to show you guys this. Look at these facts. African Americans have 2.3 times the infant mortality rate as non-Hispanic whites. African American infants are 3.8 times as likely to die from complications. African Americans had over twice the sudden infant death syndrome mortality rate as non-Hispanic whites in 2017. This is staggering. We're trying to figure out as to why this is happening within the black and brown community. And of course, like I said, it's racism, but it's deeper than that. It's almost a subconscious stereotyping that continues to happen. Listen, I've heard of horror stories. You can Google it, or even just ask any of your friends that have ever been pregnant that are black. Like they'll know somebody. This woman, and coincidentally, it was in Georgia. She was pregnant, and she was feeling pains on her side, and so she went and talked to her doctor. And every single time he shooed her away. It's normal. This is rudimentary. This is fine. This is the same thing that happens with everybody else. Yada yada yada. The pain increased over the time. She goes back like, I am feeling so much pain in my sides. I don't know what's going on. Shoot her away. She was almost in a coma at her house a very next day with her husband. He took her to the hospital. Finds out she had to get an emergency C-section. Finds out there was pools of blood in her womb. Pools of blood. She almost died. The kid almost died. And so now, and she was lucky. There were so many stories I saw of people dying because of this. Women, black women in particular. So when we talk about this, this is not some, virtual signaling. This is not race baiting. This is fact. And actually, it's been so bad that the WHO, the World Health Organization, had to come in and do a research and do a study, on racial disparities within the healthcare system in the United States. That's how bad it got. Guys, it gets even worse. And let me show you this last article. It's going to blow your mind. So a survey done by the Proceedings of National Academy of Sciences showed that of the 222 med students, half of them endorsed at least one myth and physiological difference between black and white people, including that black people's nerve endings are less sensitive than white people's. A third of these doctors still believe that that Thomas Hamilton tortured John Brown to prove nearly 2 centuries ago that black skin is thicker than white skin. A third of 222 med students. That's mind-boggling. That's terrible. That's awful. I don't get it. And those racial stereotypes is what pushes the industry into still allowing for these cyclical problems. And it doesn't help anybody, and no one blows the lid on it. And no one's going to care until we actually talk about it, until we really start protecting our community. Black people, protect your community. They don't care. It's not going to happen from the outside. It has to come from within. Because time and time again, we have enough studies, we have enough tools and equipment to show that this is happening, but no one wants to hear it. And it's going to be exacerbated by this pandemic, and already has. People are already dying and being shooed away because of preconceived racial stereotypes that are still believed within the circles of physicians, doctors, and nurses. We need more black physicians, we need more black doctors, and more black women within the healthcare industry. Until that happens, we're going to continue to see this. And pandemics are just going to exacerbate this problem. So y'all, please, if you want to get to the bottom of this, do some more research. Understand what's going on. Look into every single study, look into every single survey, look into every single story, to every person that's been affected by racial disparities within the healthcare system. This pandemic isn't going to go away anytime soon, and more people are going to die because of negligence and selfishness every single time. Let's find out more. Help me out. Let's do something more. Let's come together finally as a people, as Americans. If you're white, you should be upset as well. If you're Hispanic, you should be upset as well. Why aren't you upset because of this? Someone in our American family, you want to be gung ho, all patriotic, America first. But whenever something happens to a specific group of Americans that you might not be a part of, all of a sudden it doesn't matter. It's their issue. Prove me wrong. This is Real with O'Neal, y'all. We're going to find out a lot more what goes on during this pandemic. More things are going to rear its ugly head. Find out more. I'm going to do some more. I might do a part 2 of this. I don't know. We'll see what happens. But more videos are going to be coming your way. Check me out. YouTube. I'm going to do my own YouTube channel, broken off from TDTV. Find me on Instagram, Facebook, Twitter, all that. I'll catch you later. This is Real with O'Neal. It's real.